I get emotional when I talk about it, and I'm sorry, but they've been working so hard for 2 years, taking care of patients. And now we're going to just send people out the door?
Bridget Penick has been a nurse practitioner with Intermountain Healthcare for the last 25 years and now says Intermountain will no longer schedule her to work after refusing to get vaccinated.
I've personally taken care of many patients who have been vaccinated ×2 and have had a booster and have come in through the emergency department ill with COVID again.
Intermountain officials say a COVID-19 vaccine is mandatory to comply with President Joe Biden's COVID-19 action plan. Officials say about 80% of caregivers are vaccinated, but these healthcare workers are part of the unvaccinated 20%.
I actually reached out to my boss, being a contracted employee, and asked where I have natural immunity, if natural immunity was going to be acknowledged. And I was then met with the response of, we are assuming that you are refusing vaccination. We will work on getting your shifts filled.
Michelle Tanner is on the St. George City Council and is using her voice to support the 20%.
Because we don't have the staff to take care of these patients in the community. Now you're telling me you're okay with firing up to 20% of your staff?
An illegal overreach of our federal government to make a mandate of a medication that is still emergency use.
Intermountain ICU nurse Lindsay Guercio is spearheading a protest outside of the St. George Regional Hospital Saturday afternoon, saying she wants to be a voice for caregivers afraid of retribution.
I already feel it in my unit that I work in, that because I'm not vaccinated, I am discriminated against.
But I'm not going to get the vaccine. So I may be let go in January.
A vaccine that, regardless of how great it is, we have 1 year of data on humans now. It has to come down to an individual's choice to weigh risks versus benefits for themselves.
Reporting in St. George, Jordan Verdadero, ABC4 News.